My name is Kirsten Scholes, and I specialize in obstetrics and gynecology with the Envera Medical Group, and I deliver babies at Brookings Health System. It's important for moms to be aware of these complications because they can be signs of life-threatening conditions at times. I think just with having a newborn at home, things can be really overwhelming. They're tired, not sleeping, and it's easy for them to kind of maybe dismiss those or, lose sight of the fact that they're still at risk for some of these things that can happen. And so I just want them to be aware that, just because they've already had their baby, it doesn't mean that complications can't arise. Headaches, specifically headaches that don't go away with the use of over-the-counter medications like Tylenol and ibuprofen, or if they're associated with vision changes. Other things to look for: temperature or fever over 100.4. If the mom had a cesarean section, making sure that the incision doesn't look red or is not draining, because those can also be signs of infection. Abdominal pain is also something to watch for, specifically if the pain is getting worse or doesn't get better with medications that they were sent home for pain relief. Signs of a blood clot, because moms are at risk of blood clots after they have a baby. So things that can be signs of a blood clot are red, swollen, or tender calves. Typically, one side will be a little bit worse than the other. Also, just monitoring their mood. So if they're feeling kind of sad, hopeless, usually if I say that persists more than 7 to 10 days after delivery, that would be something to notify your provider for as well. The last thing would be bleeding. So I usually tell moms to kind of monitor the amount of bleeding. It should gradually decrease over time after they have their baby. But if they have bleeding that they're soaking through a pad in an hour, that is not normal, and they would want to notify their provider. Things in the postpartum period that you would want to call 911 for would be any new chest pain, feeling short of breath, any seizure, and then if you are having thoughts of harming yourself or your baby. For most of the other warning signs, first notify the provider or try and get in touch with your provider at the clinic. If it's after hours or you're unable to contact them, going to the emergency department to get evaluated there would be the next step. Really, anyone who has a baby is at risk for potential complications, but we do know certain things put people at higher risk for certain things. So certainly women who have had a C-section, they're at higher risk of infection and blood clots as well. Women that have had complications during their pregnancy, they already had high blood pressure in their pregnancy or outside of pregnancy, things like diabetes, those can increase their risk as well of certain conditions. There's a lot of reasons, actually. So it's a baby-friendly hospital, which I think is great. Everyone works very hard to promote breastfeeding and to help moms through that process. I think it's really great to be able to see a provider in your town without having to travel far, and then also to be able to deliver in that same location with them. They've been with you throughout your whole pregnancy. They know your history. They know your family. So I think that just helps add a whole nother level to your care.